Hello, this is Paul Chek. Welcome back to my video blog. Today I'm going to take up a topic that I get questions on quite a lot from all over the world, and that is the challenges of mouth breathing. This is part one, which we're going to overview the concept of mouth breathing, what causes it, and some basics about breathing physiology that are important to understand. Then we'll break down the common causes of mouth breathing into separate blogs where I can give you a little bit more information on each of them. So today's the overview. Breathing is very, very important. If you have seen any of you the Chek totem pole, breathing sits all the way up at the top. The only thing higher than breathing is the psyche itself. There's nothing more important to your own survival than breathing. You go without breath for about 3 minutes and your brain will start to die. By 5 minutes, you're probably going to have some irreparable damage. You can go without water, food, or most anything else a lot longer than breathing. So technically, oxygen is actually one of the most vital nutrients to the body, and people are often very unaware of that. And oxygen, as I'm sure most of you are aware, is critical to the generation of energy in the body, metabolism, etc. So the bringing in of oxygen and the balance of oxygen and carbon dioxide becomes very, very important for normal health, mental function, physiology, and psychology. Now, I'm going to take you through what mouth breathing is and all the key things I want to share with you. But first I'd like to start by giving you some of the common symptoms of a breathing pattern disorder. And you'll see by this long list of symptoms that many, many things can be caused by breathing pattern disorders. And I can assure you this is true because I've seen this countless numbers of times in my career as a therapist. Now, this book is Breathe to Succeed in All Aspects of Your Life by Tanya Clifton-Smith from Breathing Works. I believe she's from New Zealand. The book's out of print now, but if you can get a hold of a copy, it's a good one. There are several other good books out there on the basics of breathing, so this is certainly only one of the many books out there. This just happens to be one that I quite like because of the way it's written. So, common symptoms of breathing pattern disorders, of which mouth breathing is one: shortness of breath, fatigue, muscle aches and pains, sighing and yawning, poor concentration, headaches, insomnia or inability to sleep well, chest pain or tightness, feelings of panic or loss of control, dizziness, pins and needles and numbness, gastric reflux, nausea, bad breath, bloating, flatulence or farting, anxiety, electric shock feelings, eye strain, vivid dreams or nightmares, a foggy head, temperature changes in the body, an irritable cough, and a racing heart. So think of all the drugs being prescribed for addressing those symptoms every day, all of which could be the symptoms of a breathing pattern disorder. So with that little intro, you can see now that breathing is extremely critical. Let's move further in one short drink here. Now, let's talk about what mouth breathing is. Mouth breathing is a term that is used in medical circles to describe somebody who breathes through their mouth when they should be breathing through their nose. Anytime you're exerting yourself, such as running fast or doing physical labor for any period longer than your anaerobic system lasts, which is about 8 to 12 seconds, depending on how hard you're working, you could be exerting yourself enough that your body needs more air than it can get through the nose alone. Most of the time, probably a good 23 hours or more a day, you should be breathing through your nose because it has many very, very important functions to maintain a healthy breathing process. So if you look at my diagram here, this dotted blue represents air coming in through the mouth. These lines represent air coming in through the nose. The key things I want to point out is that you should be breathing through your nose predominantly, as I said, because inside your nose, your nasal cavities are lined with mucus, which has a very high population of immunoglobulin A, secretory IgA, which is a first line of defense for cavities in the body, mouth to anus, eyes, vagina, places like that, which, by the way, when cortisol levels get too high, there is a, shall we say, a diminishing of the immunoglobulin population, which leads to higher levels of challenges anywhere in the mouth, the nose, the eye, the digestive tract, rectum, vagina, due to the breakdown of the immune system as a side effect of high cortisol levels, and high cortisol levels are extremely common in mouth breathers and people with breathing pattern disorders. So the air should come in through the nose. It goes into these veins, which you look inside of an anatomy book and you can see the nasal cavities have like little bony canals that are lined with mucus and the mucous membrane and have little hairs in there. And those hairs in there, when they get stimulated, excite nerve endings, and research on breathing shows that there is a facilitation or an enhanced function of the parasympathetic nervous system. In other words, breathing through your nose helps activate the parasympathetic nervous system. I'll talk about that in a minute. So the air goes through and it gets spun around, and all the mucus acts just like an air filter in the car, and what you call a booger is all the garbage that has been filtered out of the air. And that's very, very important because lots of stuff can be in air that is very, very damaging to the body, such as toxins, chemicals, bacteria, viruses, fungi, airborne parasites, and non-organic materials such as dust and dirt and things that really isn't ideal to let get inside your body. It's best filtered out before it gets into the sensitive lungs. So we've covered that you have to moisten the air, you have to give the immune system exposure to it. The moistening of the air prepares it to enter the lung so it doesn't dry out the lung and irritate the lung. There's a stimulation effect on the parasympathetic nervous system. If air comes in through the mouth, the functions that should happen here cannot effectively happen through the mouth because the mouth is not effectively designed to be an air delivery system. So what happens is now all the stuff that should have been filtered out in the nose enters up in the mouth, so you get higher levels of bacteria, higher levels of viruses, fungi, airborne parasites, waste, and all the stuff that would be making boogers. Now it gets stuck in your mouth and makes for a bad breath and a dirty mouth where you're more susceptible to all sorts of oral challenges to do with your teeth, your gums. Also things that are coming in through the mouth and the air that can't get adequately filtered out and processed by the immune system have direct access to the gut. So you can inoculate yourself with an incredibly high number of pathogenic organisms by breathing through your mouth compared to what would happen if you were breathing through your nose. Normal breathing rate at rest, according to physiology texts, is 12 to 16, but having done a tremendous amount of therapy in my career that involved restoring normal breathing patterns and correcting mouth breathing challenges to the best of our ability, I can tell you that when a person's body is healthy, I find that the resting breathing rate is 6 to 10, which is important physiologically because if you look at the concept of biological oscillators, which you can read about in the research done by Heart Math, if you read the book called Heart Math by, I think, Doc Chilry, I can't remember the second author, you can find it easily on the internet. Biological oscillators are your three key electromagnetic energy generators. The heart is the biggest one with a field strength of about 5,000 times larger than the brain. The brain's the second largest one, and the digestive eliminative system is the third. These biological oscillators are designed, particularly at rest and in states of relaxation, to be in tune with each other, like dancers dancing or birds flying in a formation, not working against each other. So when our breathing is at a proper resting level about 6 to 10. That means we're taking a breath in, and we have a wave of peristalsis, according to physiology text, once every 6 to 10 seconds. And then research also shows when your breathing is relaxed, it also harmonizes with brainwave activity. So we get into these states of complete integration where our sense of connection to everything in the world is greatly enhanced. In other words, we have these experiences of oneness, whereas when you have breathing pattern disorders and you get overly wound, it tends to overexcite the ego function and create a sense of separation in the world, which leads to things like anxiety, depression, and other issues that have to do with feeling disconnected or separated. For athletes, being in that state of connection is very, very important because it helps keep them feeling and more aware of what efficiency is. If you look at my book, How to Eat, Move, and Be Healthy, there's zone exercises in here, and the zones are broken up due to the major nerve plexus and arteriovascular trees in the body, which correlates to the chakra system based on anatomy and the psychological themes. And in the book, I show you how to do exercises to restore breathing and energy into each of these key areas of the body. So that's in there. In my multimedia ebook, The Last 4 Doctors You'll Ever Need, I show you how to breathe properly and give you an exercise for correcting a common breathing pattern disorder. So those are some quick tips. I have another resource for you I'll share at the end. It's a more technical resource. So what I've said so far is the air needs to go through your nose the grand majority of the time to clean, moisten, and prepare the air to be in the lung and to remove any infectious or toxic agents with the support of the immune system. It goes through the mouth. Then the mouth has to take up all that burden. It's not designed to do that. It leads to bad breath and poor oral hygiene, and those things get into the gut. Your breathing rate should be ideally around 6 to 10 at rest, even though the physiological text will tell you 12 to 16. But remember, most of that research is done on the average person in society, which is a sick person. So if you're a sick person, in my opinion, 12 to 16 is probably going to be about your average resting breathing rate. But a healthy person, 6 to 12, which correlates to biological oscillators, which has a lot to do with our sense of harmony and connection, which has physical, mental, emotional effects on us. Now, breathing is extremely important to our energy production. The average person breathes about 25,900 times a day. Rudolf Steiner showed that correlates to the Earth's movement on its axis through the 12 constellations of the zodiac. The axis of the Earth, because it's on an angle, will point to each of those constellations of the zodiac as it moves for a period of 2,000 and some odd years. One complete cycle is 25,900 years. You might be familiar with that number from the Mayan long count. Steiner also showed that the average human being at that time had a lifespan of approximately 72 years, which mathematically calculates to be about the equivalent of 1 day in the life of the sun, in Steiner's terminology. So all I'm saying here is that what Steiner's research showed and what you can now find by studying these different rhythms is that the human being is utterly and completely an expression of the universe itself, and many of our inherent physiological rhythms are correlated to astronomical rhythms or extraterrestrial rhythms or rhythms of the earth, things outside of us. So that's important to know. You know, being healthy and balanced not only means that you're harmonized within, but it means you're moving with the Tao, so to speak. You're connected to all the rhythms of everything around you, which gives you a great sense of connection. And that's one of the key benefits of things like Tai Chi and Qigong, is they harmonize you not only within yourself, but to nature and the universe at large, which is a beautiful experience that I love to participate in daily. Okay, so mouth breathing itself also comes with postural aberrations. Mouth breathers tend to bring their heads down and forward, especially if they're athletic, to the degree that your head has to come down and forward to drop the jaw open, so that the mandible's a floating bone attached by the submandibular muscles to your sternum and your clavicles. So being a floating bone, as the head drops down and forward, the resting tension like springs will help pull the jaw open passively. That opens the oral airway, just like you put a big hood scoop on a high performance engine to drive air into the engine. When you have a mouth breather's dysfunction and the body cannot get enough air through the nasal passages, it tends to bring the head down and forward, which brings the pelvis forward, and then that essentially gives you more access to air to compensate for the dysfunction. But again, you're driving all that air through the passageway that isn't ideal for the job, and there's chronic adaptations to that forward head posture, which leads to all sorts of muscle imbalances and joint problems and things I can describe in more detail in an upcoming part of this blog series. Okay, so now we want to look at some of the key things that are related to breathing balance versus imbalance. When we're breathing in, we're bringing in oxygen, and the waste product of our cells, the gas CO2, those two have to have a working balance with each other, or we run up against all sorts of physiological challenges and riddles, the symptoms of which I just read to you. So if you see my Tai Chi symbol here, the metabolic functions of yin relate to digestion, elimination, growth, repair, rest, recovery, cooling, and moistening. Yang relates to increasing metabolism, sympathetic nervous system excitation, blood flow moving out to the periphery, whereas the yin function is to bring it into the organs. So there's a very important energetic dynamic that has to go on that is easily disrupted with a breathing pattern disorder. So we'll just run through some of those functions. With regard to breathing pace, the yin element would be enhanced with slower, more relaxed breathing. As your breathing goes faster and faster, you're going to activate the sympathetic system. If your yin function is working, you have adequate CO2, which has very important calming effects on the nervous system and stimulating effects on the parasympathetic nervous system. And here we need to breathe faster for oxygen, energy, and metabolism. But if we're breathing wrong, mouth breathers tend to breathe too fast in general. That's classic hyperventilation, and they outgas more CO2 than they should, and it throws the balance of CO2, the sedating function, off in favor of the exciting function of oxygen, which can have some long-term negative effects. I'll list a few of them. So the slower breathing and the optimal amount of CO2 enhances parasympathetic nervous system digestion, elimination, growth, and repair. But if you're breathing too fast or you have this gas imbalance for too long, you will get overexcitation to the sympathetic system. If you're breathing fast because you're working hard, you need that excitation to the sympathetic system because that triggers the change of blood flow from the organs to be predominantly in the muscles to bring enough energy and oxygen in and waste out to do the job. Slower breathing and CO2 functions have a calming effect on the mind and the body. Faster breathing and oxygen has a stimulating effect on the mind and the body. Not only does it stimulate the mind and the emotions, but it stimulates the muscles. And like I said, if as sympathetic tone or excitation rises up, the blood is diverted. About 5/6 of the blood under extreme physical activity could be diverted out of your digestive eliminative systems into the musculoskeletal system. So if a person's got a breathing pattern disorder and they're mouth breathing and breathing too fast, they can be doing that all day and all night. So technically, biologically or chemically, the body thinks it's running a marathon all day and all night, and it keeps the blood out in the musculoskeletal system, and that makes digestion and elimination a lot more challenging. So you get a lot of things like food intolerances, digestive disorders, changes in bowel movements such as constipation, enhances the likelihood of overgrowth of pathogenic bacteria, funguses, and parasites in the system. So not good. If you have greater oxygen coming in through breathing, then you have greater work potential and decreased digestion and elimination potential, as I said. If your body is calm and you're not doing too much physical exercise, basically the threshold is exactly what I teach for working in. If you do not elevate heart rate, if you do not elevate breathing rate, your tongue is staying moist and you can do the activity on a full stomach, you're going to maintain adequate volume of the blood in the organs and enhance the anabolic systems of the body. But if you deviate from those criteria doing any kind of activity, then you're going to enhance excitation of the musculoskeletal system. And with mouth breathing and elevated breathing rates comes an increase in muscle tone. So people start to get stiff, they lose flexibility, they often have joint aches and pains, and they frequently pop fingers, snapping fingers, popping necks and backs, because the elevated muscle tone puts chronic compression on the joints, which leads to excitation of mechanoreceptors that send a message to the brain to prepare for greater load, which causes a reflex reaction to tighten the muscle. So you can get this runaway progressive increase of muscle tension, which leads people to doing what's called chiropractic masturbation, which is popping your own joints all the time, which can lead to structural problems because that ends up leading to ligamentous laxity. Okay, so also carbon dioxide, when it's in the right volume, helps muscles relax. So for example, someone that has too much oxygen relative to carbon dioxide could find themselves having a really hard time going to sleep at night because their body aches a lot because everything's still wound up. Okay? Now, the causes of mouth breathing come in three basic classes, and I will use one blog to describe each. You can get mouth breathing and breathing pattern disorders as a result of psychological or mental emotional disturbances. You can get it as a result of physical or congenital problems, such as structural problems, postural problems, or growth and development problems, and we'll talk about that. So we'll do the growth and development, and we'll also talk about posture and structural influences in that blog. And another huge one that can lead to mouth breathing and or breathing pattern disorders are biochemical dysfunctions, which come from food and drink, fungal and parasite infections, bacterial dysbiosis, toxicity of the land, water, or air, which of course includes the food, and let's see, drug side effects. There's a lot of drugs out there that will disrupt breathing patterns. Many of them will disrupt not only breathing patterns, but they disrupt the biochemistry of the body, and the breathing pattern disorder is a sort of a side effect of that. I'll tell you some very interesting things when we get to the food section. I don't want to let the whole cat out of the bag or it won't be so fun. So that's the overview of the importance of the balance of the chemistry, the basic chemistry of breathing, which I've kept quite basic because it can get more technical than we need to get it. The causes of mouth breathing, normal breathing rates, the importance of the nose versus the mouth, the importance of harmonizing biological oscillators for overall psychological and physical well-being. And now what I want to do is leave you some tips. The most important thing you can do, because as you can see there can be many causes of this, and even after watching these blogs you may still need professional help because a lot of these things get into your body and cause problems. In other words, you could have a parasite infection. So just because you start eating better today doesn't mean you're going to get rid of your parasite infection and all of a sudden magically clear out your breathing pattern disorder. So you may need resources or professionals to help you, but at least you'll have some idea of what to do through this blog series. The tips I want to share for you is the basics of breathing. Any of you that thinks from listening to this that you're a mouth breather might want to, I suggest you practice taking a normal diaphragmatic breath. You put one hand on your belly, one hand on your chest, stand with good, relaxed, upright posture. Inhale through your nose, let your belly expand to about 2/3 of your maximum breath. Key thing is let the belly expand. This is particularly important for the females who often psychologically don't want to let their bellies out, which is a big problem in these disorders, which relates to aesthetics. So you're going to take a deep breath, filling the belly first, and only in the last third does my chest start to move. And then just let it exhale naturally. There's no need to think about that. Exhalation is driven by the spring in the ligaments and the weight of the rib cage, and it just outgasses, so there's no, you're not going to exhale wrong is what I'm saying. Okay? One more time. Actually, I'll take my shirt off. It might be easier for you to see what I'm doing because I'm going to show you another exercise. So hand or finger in the belly button, hand on the chest, inhale through the belly. And just now my chest is going to start to move. In the last 1/3. Okay, so 2/3, 1/3 rule. Just practicing that with conscious awareness of breathing through your nose, either sitting or standing with good posture. You don't want to practice breathing in a faulty posture because it crowds the diaphragm and puts the diaphragm up against the organs and makes it very hard to do, and it activates the respiratory muscles in a faulty posture, which reinforces the faulty posture. If you can't get yourself in a good posture because you're not aware of what you're looking at or you're not posturally clued in, then you could lay on the ground on your back and the earth and gravity will do it for you, and sometimes I do have to start people there. Another tip is a technique that I developed years ago to help people with breathing pattern disorders. In my book, How to Eat, Move, and Be Healthy, I show you how to use the string as a tool for activating the core to reprogram the nervous system, how to set up the stabilizer sequences in your body so you minimize the risk of injury with movement in general or athletic type movements or weightlifting. We're going to use that technology backwards. So we're going to now take a string, and what you want to do is at rest, in other words, not inhaled, breathe out with the air out, tie that string into a knot just over your belly button or a bow. If you can tie it tight enough, you need it to be tight. Excuse me. Then what we want to do is wear the string as often as you'd like. A tip I use with my patients is I have them set their watch to beep every hour on the hour, and I have them practice taking a good 10 to 12 full breaths using the string to remind them. So now what happens is we get what's called a negative feedback loop. If you're breathing with the string technique, you want to consciously make yourself aware of expanding your belly before your chest moves to get that sense that the string's digging into your belly. Then let the chest move once you feel it digging in. Then relax, and as you exhale, the tension comes off the string. Breathe in, expand the belly first. When the string starts to dig in, go ahead and let the chest come up. Now that technique gives you some sensory awareness as to what your abdominal wall's actually doing while you're doing the exercise. And many people have what's called sensory motor amnesia, which means sensory, feeling, motor, movement, amnesia, I forgot. They don't have a feeling of what they're doing in their body, so they don't know whether their belly's going out or in. So the string, preferably kite string, this is all I had here today, so it'll dig into you. If you really want to do it, get some dental floss. It's good and tough, and it'll give you a nice reminder that you're expanding your belly. You don't want it to hurt so much that it stops you from breathing, but you just want to be aware that as you're breathing, something's digging into your belly. And it's no problem to feel that. And again, take that, let the chest move in the last 1/3. By practicing breathing like that with enough regularity, at least once an hour for 10 to 12 breaths at minimum, over time you can actually retrain the breathing apparatus to start sequencing the movement properly. That allows the diaphragm to drop down. As your belly's expanding, the diaphragm's like an umbrella, and as you breathe in, the umbrella pulls down, drawing air into your lungs, but it has to push the organs down or it can't move. So we want to be very, very aware that expansion of the belly means that there's more air coming into the lung. All the way back in 1934 in the book Body Mechanics and Health and Disease by Joel E. Goldthwait and other authors, showed that the average person's only using their breathing capacity at about 1/3 to 2/3 at best. Not enough. In other words, we're not oxygenating effectively, and that was in 1934. Okay, so that gives you some tips. The 2/3, 1/3 rule, string biofeedback. Now, one of my very skilled level 4 Chek practitioners, Andrew Johnston, who has written a number of various books on very neat things, on conditioning and all sorts of stuff. This guy's a super stud athlete. He wrote his Chek level 4 thesis called Holistic Respiration. And if you're interested in reading that thesis, you could find it on the library, possibly at the Chek Institute. I don't know if it's up yet. But you can email Andrew and ask him about getting a copy of his thesis, which is his Chek level 4 thesis. All of my students have to do one to graduate. Andrew at triumphtraining.com, TRIUMPH training.com, or you can go to triumphtraining.com and learn all about what Andrew has to offer. He's got some really neat DVDs. I could give you a long story about how amazing this guy is, but he goes quite deep into the biochemistry and many of the things that I'll overview on the blog in summary form. So if you really want to get into this, Andrew's your man. Thanks for joining me today. Just a reminder, you can learn the breathing basics in my multimedia ebook, The Last 4 Doctors Will Ever Need, How to Get Healthy Now. And you can learn how to use breathing with specific exercises to help create balance in key physiological systems based on your high scores in your questionnaires in my book, How to Eat, Move, and Be Healthy. Thank you. I think I'll remove my string now. It's been nice to share the string, the blackboard, and a few tips on breathing with you. I'll see you soon. I'm Paul Chek.